My name is Dr. Milena Gandy, and I'm a senior clinical psychologist as well as senior research fellow at the E-Centre Clinic at Macquarie University in Sydney. When I was a young teenager, I moved with my family from living in Sydney to a very small town in the south of Ireland, which was a big culture shock for me from going from a big city to a small rural town. And I spent almost a decade living and studying in Ireland. Yeah, and I really enjoyed my time there. So it's kind of my second home now. I feel really inspired to kind of get up in the morning and do my work as a clinician and a researcher, really to kind of make a difference to people's lives that are living with neurological disorders that can sometimes struggle to find good support for mental health and well-being. And it really kind of motivates me to do meaningful work to improve the access and effectiveness of psychological care for people with MS. So I recently developed a digital online psychological treatment program, which I've called the Wellbeing Neuro course. And this online course, it teaches all the same skills that you would get face-to-face with, say, a specialist clinical psychologist or neuropsychologist, but it's delivered all online through kind of carefully developed modules. And the support by psychologists is over the phone and via private messaging systems. And the Wellbeing Neuro course covers skills for managing well-being broadly. So it covers skills for managing both mental health, things like depression, anxiety, and stress, but also the cognitive difficulties, and day-to-day functional difficulties like problems with memory and attention. In the past, these types of issues used to be treated separately. So the course is bringing it all together. And the beauty of the course is people can do it in the comfort of their own home. So it gets around a lot of those access issues. But my current exciting research project now is trying to kind of move beyond some of the early clinical trials of the course where it was found to be really promising and had great results. But my research is now moving towards seeing whether digital psychological treatments like the Wellbeing Neuro course are effective in kind of what we call more real world settings within the community and within clinical settings that people with MS use in day-to-day life, because I'm really keen for my research to be sustainable and not just research that ends there, that it really translates to improved patient care. I'd love for this research to really inform a new model of psychological care for people with MS. So it will be able to give us really good information about whether digital treatments are a sustainable and feasible, acceptable kind of method of psychological care for people with MS. And I'd love to see this research then to have broader kind of impacts on a healthcare setting, that different services would consider integrating digital treatments into their service models for their patients, and really for people with MS to be able to access the Wellbeing Neuro course or other digital treatments outside of just clinical trials. I'd like to say that, it is really normal and understandable that people with MS at times can struggle with their well-being and mental health. But the good news is that there are kind of effective psychological treatments out there. Myself and lots of other researchers are looking at ways to make them even more effective, but most importantly, accessible. So, if people are struggling out there, there are things that can help and can make a big difference.